Thank you for joining us today, everyone. Again, in the Legislative Building in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Joining us over the phone line in Saskatoon is SHA CEO Scott Livingstone. Both the Premier and Doctor will have brief opening remarks, followed by questions. Premier?
Well, thank you very much, and good afternoon, everyone, and I want to thank you for joining us here today. Today we are reporting 5 new cases, as well as we have 19 additional recoveries, which brings our active case count in Saskatchewan to the number of 76. The increase in case numbers over the recent number of days has been quite concerning and should serve as a reminder for each and every one of us that we have to continue with all of the good practices that have worked for us and have been successful thus far. The case numbers, I would add, are going to change from day to day. Some days will be higher, some days will be lower. But that in no way should change our behavior from day to day. We have to keep doing the right things each and every day. The physical distancing, the washing your hands, controlling your number of contacts that you come in close contact with, staying home if you're not feeling well. We are now about 4 months into this COVID-19 pandemic in Saskatchewan. And while we have done an excellent job overall at keeping our cases low, our hospitalizations low, and most importantly, our fatalities very low, we have seen and we continue to see local outbreaks that show just how quickly this virus can spread if we let our guard down, even if it's just for a moment. So let's continue to be careful. The risk has not gone away. We have also shown that we can get these outbreaks under control if we do the right things. I want to commend everyone in the community of La Loche and other northern communities for everything that they have done to control the outbreak in that part of our province. Number of active cases in the far north is down to just 6, the lowest number since that outbreak started back in May. That is very good news. But again, the virus can still spread at any place and at any time, so we all need to continue doing our part. There have been some recent media reports that the federal government is likely going to extend the closure of the U.S. border, and I would fully support this right now. Because right now the COVID situation is very, very challenging in the U.S. and it's getting worse. In Saskatchewan, our case numbers are going up and down. In the U.S., they just continue to go up and up. So we need to avoid that type of a situation here. So the Canada-U.S. border should stay closed to non-essential travel for the foreseeable future, at least out to August the 21st. Finally, I just want to mention that at the start of July, like many other provinces, we moved to a system here in Saskatchewan of not reporting new case numbers on the weekends. We did so because our cases had been pretty stable for a number of days and weeks at that point. And because we wanted to give some of our health staff, who've been working very hard, a little bit of a breather on the weekends. However, this did cause some concern this past weekend with higher case numbers. We're fine weekend before where we had lower case numbers and did not report, but this past weekend we did have some higher case numbers and it did create some concern, and for that reason, and because we want to be as forthcoming with information as possible, we want to be as transparent as we are able, we will be going back to daily reporting of the case numbers 7 days a week, including on the weekends. So once again, thank you to everyone in Saskatchewan for what you've been doing, and let's just keep doing it day in, day out. Thank you. Dr. Shahab?
Thank you, Premier. So just to recap the numbers, we are at 876 total cases. 3 new cases are in the central region, 1 in Saskatoon and 1 in Regina region. 76 are considered active, so again, going down again. 6 people are in hospital, 4 are receiving inpatient care in Saskatoon, 2 are in intensive care, 1 in Saskatoon, 1 in the south. Total of 785 people have recovered. And again, we will see ups and downs in our case numbers. Some of them are a result of active case finding, but even if our case numbers are up, as long as we can explain them because they are part of active case finding, outbreak investigation, and so on, I think that's a good thing. So case numbers alone being high should not be a cause of concern. And similarly, if our case numbers are low, it should not lead to any complacency that there's no COVID, because we see that We have occasional sporadic cases throughout Saskatchewan and even in the south and central areas. We've seen some sporadic cases, and in the right setting, which can include gatherings where physical distancing is not being observed. Some of the things that we do all the time, getting together with friends and family over a meal, it can transmit very quickly. So we need to continue observe the good practices going forwards, and maintaining some of those close connections to our immediate household or to our virtual household up to 15 people, paying attention to whatever gatherings we are having about, practicing physical distancing, being considerate of others who may be at greater risk. Because we know that these measures have kept our numbers overall low, and as we move forward with more activity in terms of recreation and economic activity, these behaviors and practices will ensure that we can continue doing so and keep our case numbers manageable. And finally, if there's any concerns, testing is now widely available. We strongly encourage anyone with symptoms to get tested, and if anyone has any concerns, to call 811 about options for getting tested. Um, like I said yesterday, there may be some public service announcements that will continue to happen if public health cannot follow up on all contacts, and that should not be a cause of alarm. Even if you were at the location, all that means is you should monitor your symptoms, and if you have any concerns or any symptoms, you can seek testing or advice from 811. Thank you.
Thank you, Doctor. And we'll take our first question from the room. Arthur?
Mr. Premier, I'm sure you're aware that there's a well-being program run by the We charity that's raising questions here in the province. Could you explain what you knew about that proposal, how it was conveyed to you, when you knew it, and what you knew about We's involvement and the nature of the contract?
Okay, there is no contract as of yet. Now, maybe just back up a little bit to this whole conversation and my name and my wife's name that have been brought up with respect to the We Foundation. My family has been involved in supporting the We Foundation for a number of years, through my daughter originally, then my wife and my daughter. And most recently, my wife and I had attended in Kenya this past year. That was a personal trip, and it was we paid for that trip personally, and it was we did not get paid in any way for our participation in that trip. That was a personal trip for us. I was aware that We does do business with a number of governments. I wasn't aware whether or not they did with the Saskatchewan government, so I approached prior to going on that trip. I approached our conflict of interest commissioner and inquired with him, and he had said there was no conflict in this particular case, and to my knowledge, there has been no contract with the government of Saskatchewan to date. Although the government of Saskatchewan is looking at a contract in the area of mental health in our schools, which is the We Wellbeing initiative that you had put forward. This is an initiative that is being looked at in multiple provinces across Canada. In the fall would be when I was made aware of that. I did discuss it with the minister, but I have not been involved in any of the procurement or any of the contract that is being worked on. Let me back up to the contract that is in place, that is being looked at here. The government is going through their due diligence with respect to the well-being contract. When a charity comes forward with a contract of this nature, what the government does then is it has a system where it will offer that contract out to see if there's other charities that are involved. It's called an ACAN, or an Advanced Contract Award Notice. This is very similar to the contract that came forward between the Ministry of Education and the Kids Help Phone, for example, where that contract can then be offered if there's interest from other charities. There was none in this case. It is the We Foundation was the only charity that has been interested in this. So it continues to find its way through the government due diligence process. There's been no cabinet decision on this or no cabinet presentation on this. There are other provinces that have run pilot programs of the We Wellbeing program. Nova Scotia, Ontario, Manitoba, Alberta have all run some degree of a pilot program on this particular program. There may even be some school divisions that have done some work with this, as well as our friends in British Columbia have also run a pilot program, or have indicated they're going to as recently as April of this year. So there's a number of provinces that are that are looking at this, including Saskatchewan, who has not made a decision on it as of yet. So I would have been aware of it maybe late last summer, early last fall, of the We Wellbeing program in itself. I have discussed it at least once with the minister, but it's finding its way through the due diligence process of government. I would just add, this is an area of interest to us, not because we is offering it, but the area of the opportunity to potentially add to the tools in our tool chest, if you will, in providing services and supports for those that may be struggling with mental health or have mental health challenges, in particular in our K-12 system. So other provinces have moved on a pilot program in this. We haven't made the decision on it yet, and we may in the future.
Follow-up, Arthur?
So if you were aware of this in the summer or the early fall, first of all, were you aware that it would be we most likely running the program and that the contract would be offered through an ACAN? And secondly, why would you then decide to go on that trip where you were in close personal touch with the Kielburgers who were applying for this contract and were in the process of
yeah, I don't know if there was an application at that point in time for this contract. The two conversations were separate with respect to an idea around a supportive program when it comes to providing mental health services in our K-12 school. There's many other programs that the We Foundation and other charities offer. So that was one conversation, and the support that we have as a family for the We Foundation is quite a separate conversation from this for sure. The two are not tied in any way. As we've been involved with being supportive of the We Foundation for be a number of years now through it. As I said, my daughter, my wife, and then ultimately this past year myself, and we may be in the future. Where there is an opportunity for us to have a conversation around expanding the supports and resources when it comes to mental health, this is something we've invested in. We're not going to leave any stone unturned. So I'd mentioned it to the minister, and they had picked up from there.
Do you have a further follow-up, Arthur?
Yes.
How is this, different from what the PM is now facing? Because because he's also facing questions about his close personal relationship with the Kielburgers and the role that might have played in the process. Can you assure people that you had absolutely no role whatsoever that may have advantaged we in any way, and explain how your position is different from the Prime Minister's?
Well, one, I didn't receive any money. Two, I approached our conflict of interest commissioner immediately before doing anything on the personal side with anyone that's associated with this foundation. And three, there's a number of other provinces that have already moved on this pilot program. Saskatchewan is not among them at this point in time. So there is no conflict here, as has been assessed by the conflict of interest commissioner, and I truly believe there most certainly isn't. So it's a very, very different situation than what's happening at the federal level.
We'll take our next question on the phone line, operator.
We have Roberta Bell with Global.
Hi, I was wondering if there's any more that you can say about the contact tracing that's going on in the Southwest, specifically with regards to the Hutterite colonies that are affected in those regions. Can you tell us if there's any additional measures that are being taken to I guess, track how it's spreading?
So there's kind of, as we discussed yesterday, and the actual numbers today will be a bit different, but if we say that there's about 56 or now maybe 60 cases in total reported for the last few days in the southwest and west central parts of Saskatchewan, about 10 of them are related to sporadic events, and contact tracing for them is happening. And I just want to flag that although we were not reporting cases over weekends, public health and the health system works 24/7. So case contact investigation continues late into the evenings, even on weekends. So it's not like case contact investigation stops over the weekends. And staff really have been spending a lot of time doing meticulous case contact investigation. What it means for a single individual who has not had a contact with any case and test positive. First of all, we have to recognize that it's up to individuals to go for testing even if they have mild symptoms, and we really need to support that, because that then informs us in terms of who else may have been exposed, try to understand the chain of transmission, and if we can identify that through case contact investigation, that's all that's required. But if people have been visiting a public place and we can't identify everyone who may have been a close contact, then a public service announcement is done, and that is there may be ongoing public service announcements related to the 10 or so cases which are sporadic. And then the rest of the cases, I think we have to recognize that while 46 or 50 cases sounds like a big number, they are actually generated through participation of communities and communal living settings with public health to do active case finding. If no one shows up for testing, then it's very hard to control an outbreak. We need cooperation of communities who live in communal settings where case contact investigation is done. Anyone, even with mild symptoms, is offered testing. That generates a lot of cases, but it is like a large household setting. And just like in the Losh, if there had been no public health follow-up, the total case numbers would have been lower, but the outbreak would have gone on and on because the intervention wouldn't have been there. But through active case finding, case contact investigation, and enhancing access to testing, the case numbers rose in the Northwest, but that's how cases and contacts are isolated. So similar process is being done with communal living settings where there's active case contact investigation, and then obviously cases and close contacts are asked to isolate for 14 days till symptom free or till no symptoms develop if you're a contact, and that is how you overcome the chain of transmission. And we've already seen in earlier communal living settings that very quickly through that process the outbreak is controlled and ends, and we expect the same process to happen in other communal living settings. But I think we need to understand that obviously communities who may be identifiable for a variety of reasons feel very concerned when something like this happens, and we need to understand and give them the space and public health the opportunity to work with them to address that outbreak. It's just like if we had an extended household in our own family and we had extensive cases at a family gathering, we wouldn't expect that to be public knowledge if we could account for all the contacts, and we would work with public health to make sure that people who are symptomatic are isolated, people who are contacts are isolated till the whole issue is addressed, if something like this was to happen at a private family gathering. So I think same principles apply for communal living settings, but we have to be considerate to give public health in those communities the time and space to address this, and especially not point fingers or stigmatize people who may be otherwise identifiable. I think this has happened in the past in other parts of Canada for specific groups who are otherwise identifiable, and I think we need to apply the same consideration to our friends and neighbors in Saskatchewan as well. And we have to remember that right now, specific issues happening in the southwest and central west part of the province. This can happen anywhere. This can involve me and my household and my extended friends and family. It can happen anywhere, and we need to give the same consideration to communities and families facing this that we would expect to get for ourselves if we were in that situation.
You have a follow-up, Roberta?
Yeah, so on that note, is there any specific, steps that are being taken for specialized testing or for, culturally specific or sensitive, measures as you're trying to, curb the outbreak and the spread of the virus in these colonies that might be mostly affected?
So in this particular case, public health staff live and work with the communities that they serve, and I think public health staff at the front line understand the situation. They work very closely with communities, and that's exactly what's happening. They're working with families and local leaders and communal living setting leaders to do exactly this, that working with those communities to make testing accessible, to advise around case contact investigation and what further needs to happen. And already that is showing results in the southwest where there was a significant increase in cases that's now settled down, and that those same principles will allow all other communal living settings to address this in over the next few weeks.
Is there a further remark from Scott Livingstone on the ongoing work of the SHA with the Hatarian Safety Council?
Yes, thanks, Jim. I think is a good point to bring up is that the work of the local public health staff from SHA with Outer Age Safety Council, which represents Manitoba, Saskatchewan, and Alberta, has been a tremendous asset to be able to come into the colonies and actually work with the people across southwest Saskatchewan to give us access and support as we are actively testing and case finding with them. So I think the big change is we're coming to them instead of having to bring everybody to us, which has been one of the reasons why we're finding the cases which we need to, and as that Dr. Shahab has already pointed out, that's a good news thing, and that cooperation is going to go a long way for us to contain this outbreak, just like we have in the prior two colonies where we started the work with these individuals.
We'll take our next question on the phone line.
We have Taylor Rattray with CTV.
Hi there. So in the past, the government has included flights with confirmed COVID-19 cases in its press releases. I'm just wondering why this was not included in a press release yesterday, since on the website there's 5 listed posted on July 13th.
So I think what has happened, and I will confirm if we now don't, as a matter of policy, mention it on news releases. But I think the message to anyone who travels domestically or internationally is that if there is a case on a flight, international or domestic, the risk of transmission is lower because everyone is expected to wear a reusable mask. You should not travel if you're unwell. And there have been few instances, and I'm not aware of any instance actually in Canada, of transmission happening due to being on a flight where there was a case. But having said that, I think it is incumbent on anyone who travels domestically or internationally to go to the provincial and federal website where flights are posted. So 2 weeks after air travel, every 2 or 3 days, go online to check both the provincial and federal list to see if your flight is mentioned. But even if your flight is not mentioned, we do understand that when you travel in close proximity, you should, in any case, self-monitor yourself for 2 weeks. So some of the flight posting process has been streamlined, and it's just posted automatically on the provincial and federal website. But I can check if we still need to mention it in news release. But again, we have to remember that if you've traveled, you may not see a news release, but you should really visit the website where the flights are posted, both federal and provincial, and both those links are on the website. And having said that, I think we often say the need for self-monitoring, that our new normal is not just keeping our physical distance and keeping our contacts low in terms of as we're out and about, but also being very aware that if we're feeling unwell or if anyone in our family is feeling unwell, we really need to seek testing and then further recommendation if the test is positive. In most cases, it's a mild illness that recovers while isolating at home. But I think testing is an important part that will make sure that we keep ourselves, our families, and our communities safe.
Do you have a follow-up, Taylor?
Yes. What's your response to teacher and parent concerns over student safety in September in light of COVID-19?
So we have actually at the national level, we have learned from provinces that opened their schools for a couple of months in May and June, and the news is quite positive. So we've already seen in Saskatchewan, for example, the daycares have been open throughout. They went down to 8 children, they've gone up to 15. They will continue to expand as people re-enter the workforce. So we've seen no concerns in daycares. We expect that school reopening would be fairly straightforward. Obviously, for young children, it's really important for them to be in school in that classroom environment. It's very important for them to have as normal as an environment as possible. So there can't be a lot of stress on physical distancing, certainly for school children, mask use in the classroom is not recommended, especially for younger children. And they need to have as normal a classroom environment as possible. And of course, there may be some things that are different in school, some cautions around food that's being served, single servings, some cautions around not having large assemblies, some staggering of playtimes. But at the end of the day, the classroom would be considered like a cohort or a virtual household for children going to school. But I think generally the experience from other jurisdictions, other countries has been very positive. But of course, if there's an increase in community transmission where a school is situated, or if there's a case in a school, appropriate public health follow-up will happen to reassure parents or take any further actions that are required.
I would just add to that, Taylor, some of the process that we've gotten to in as we find our way to having the opportunity for our kids and our teachers to safely enter the schools this fall. First of all, Dr. Shahab's right. We've been learning from other jurisdictions, other provinces, other places around the world on what a safe return to school does look like. A number of weeks ago, we saw the public health come out with a number of recommendations or guidelines from the provincial government that then went to the school divisions, the school divisions across the province, who are autonomous in how they operate, and we're then putting together their processes and their procedures in each of their, not only school divisions, but in each of their facilities to ensure that they are going to be able to operate each of those facilities as safe as possible. Those policies and procedures came back to the Education Response Planning Team, which the Minister of Education had assembled, included members of Public Health, the Ministry of Education, but also our Saskatchewan School Boards Association, as well as the Saskatchewan Teachers Federation, that will provide any additional input on those policies and procedures that the boards of education have in place. So this has been a very strategic and methodical process from the beginning. They're hard at work now. The Education Response Planning Team will be working throughout July so that we'll be able to hopefully get back to the school divisions with some more precision, if you will, on their operating procedures sometime in August, and ensure that it can be communicated to children, to staff, and to parents across the province. So it's been a very strategic process to ensure that we can have the opportunity for our teachers and our kids to return to school as safely as possible this fall. And it started with identifying and learning what other jurisdictions are doing.
We'll take our next question on the phone line.
We have Phil Tank with the Star Phoenix.
Yeah, I'd like to clarify. You may or may not be aware that a hardware store here in Saskatoon has alerted the public to a worker who tested positive. Saskatchewan Health Authority didn't, but they did alert about a restaurant worker that was a few days earlier, or a few days close to that. I'm just wondering how you make a decision on how you alert, when you alert, whether it could, because it seems unlikely that you would be able to trace everybody from a restaurant or a hardware store. So I'm curious what the standard is for issuing an alert.
Yeah, that's a good point, and I was actually made aware of that just a couple of hours ago, and I did confirm with my colleagues in Saskatoon, and they confirmed that when they did the case content investigation, there was no exposure to the public, so that's why a public service announcement from public health was not considered necessary. But certainly businesses are free to post if they want, and certainly businesses are encouraged to post. And I think this all relates to the fact that we need trust and confidence to get tested ourselves. We expect not to get stigmatized if we test positive as individuals or communities or as businesses. And this is just, a public service if businesses choose to go above and beyond what public health thinks is necessary. And it does not mean that a business isn't following guidelines. All it does is it raises awareness. And we also have to remember that all of this is predicated on someone actually seeking testing, and we all know that in some cases people can be asymptomatic or have mild symptoms and not think of getting tested. So public service announcements are useful, but we all need to be aware that as we're out and about, we keep that physical distance, and if we have any symptoms, we should seek testing in any case, and that's how we need to know if we have any COVID activity, and that just informs ourselves and our communities. But in this case, I reconfirmed, and the public health decision was the appropriate one, that there wasn't a requirement to post. But certainly, if businesses choose to post, that's fine as well. I think they're just doing their, trying to just be as transparent as they can. Because I know that in the past we've had similar situations where through social media the question has come up for a grocery store or other things, that someone said something about someone being ill and there wasn't a PSA, and that will continue to happen. Public health will only post from its side a public service announcement where it thinks it's necessary because all contacts cannot be traced. It's not incumbent in those situations for businesses to post, but if they choose to do so, that's certainly their decision. And I think all we can say is that that's a good corporate decision, and it's also about building trust. That we shouldn't actually be concerned about posting these things either through public health or through the business.
Follow up, Phil.
Yes, Dr. Shahab said at the beginning of June that a new model for reporting cases with more specific information was coming, and he seemed to hint at that again yesterday. I'm just wondering why people should have faith in the reporting system if it seems to be under reconsideration all the time. Like, we saw very specific information with the, very small rural municipalities named yesterday. Just why should people have faith in your approach on this to reporting cases?
Yeah, I think so. What we have done is we've constantly looked at what's the best way to report cases in terms of the context. Is it a single case? Is it a case linked to a household setting? Is it an outbreak, or is it otherwise an issue of concern? And we have to remember that we have a fairly small population. If you look at globally, states and countries, we have a population of 1.2 million spread over a vast geography. Saskatchewan could include several countries in Europe with 10 times bigger population within its geography. So we have to be we have to be consistent. We have to be conscious of we have to convey information in a way that makes sense. So, for example, for the most part, the way we display information on our dashboard is good because it has far north, central, south, and Regina and Saskatoon, and gives a good bird's eye view of cases, active cases, tests, ICU, and hospitalization. But already we knew that most of the cases in the far north 2 and 3 months ago were being driven by specific outbreaks in a few communities in the northwest. So we were very specific about that information and not just saying that they're just in the far north. Similarly, we had a bit of a concern with the Lloydminster area, so we were specific about the Lloydminster area, not saying that it's just in the north. So where required, we do become specific. Similarly, a couple of weeks back, we had an alert for the PAN area, Prince Albertine area, so that's a larger geography with quite a large population, about 60 to 80,000, but we saw 6 hospitalizations, so we want to make sure people are aware to seek testing. Not that people outside of that geography should be complacent, but just to flag that, especially if you live in the PN area, just a reminder for you that seek testing if you're symptomatic. And we looked at the testing numbers in that case for PN area and compared to it, for example, for North Balfour area, for other parts of the province, and we found that certainly testing rates in PA were not very low; they were about average, but we still wanted to encourage a high level of testing. And so those 6 hospitalizations generated 100 plus contacts that public health followed up. There was no need for a PSA in that setting, but it did lead to follow-up of 100 plus contacts, further testing through contact tracing and through the general public coming forwards. And so far, we have not seen any further signals of concern, which is good. And now in the southwest, initially, when there was an outbreak about 4 weeks ago, an RM was named, RM of Maple Creek, because that was the geographical area. So again, a much smaller geography than the northwest, and a much smaller population than overall population than Lloydminster, PA. And then yesterday, several communities were listed in terms of communities and the general area, because again, it's not helpful to just name a community. It is the community general area, and those communities were chosen based on advice from leaders and frontline staff in southwest and central parts of Saskatchewan, that generally people, if you're from a small community, you say, I'm from this area. So that's how that list was compiled. And so we'll have to scale up and down as is relevant, because geographies can be very big. So we have to, we can be as precise as we need to just flag something of concern, or we can be quite broad, like for the PN area, when it's not really that specific in terms of geography.
We'll take our next question on the phone line.
We have Alex Soliduca with CBC.
Hello. With data from the past week, some experts are saying that the RT number in Saskatchewan is now at 3.74, while for comparison, Alberta would be at 1.77, and that Saskatchewan now has the most alarming numbers in the country. Have we let our guard down too much as a province, and what action should we be taking to lower this number?
So I've not seen the updated RT for this week, but we work very closely with the modeling group that works with the Saskatchewan Health Authority and the University of Saskatchewan, and so our effective reproductive number or RT number does fluctuate very quickly with an increase in cases. And again, if the increase in cases is in a small population, it does fluctuate quite significantly. And so when I did my presentation last week, I did show that the RT for the Northwest has gone up to higher than 2, but then it came down to less than 1 now, and that really shows how when communities work with public health and the health authority to really do active case contact management and testing, ultimately the numbers come down. So it's gone well below 1 now. And similarly, we saw 2-3 weeks ago that there was a bit of an increase in the RT because of the clusters in the southwest, and now we're seeing that in the central parts as well. But again, it's we have overall low number of cases. We get a bit of a cluster because of transmission and active case finding that does pull up the RT, especially at a local level, but also to an extent at a provincial level. But because we can identify the chains of transmission, we understand that, and we really don't get that concerned. We know that even though the RT is going up, it's not going to overwhelm the health system at this time. It's an outbreak cluster that through active case contact and through the cooperation of the communities, it's being managed and being controlled. Having said that, if we were to see a high number of cases throughout the province were not linked to each other, and I've said in the past, 100 of cases or more a day, for example, that would be an area where we would be getting more concerned and would have to then deploy extra resources for testing and case contact, because 40, 50 cases in a specific part of the province who are all linked to specific communal living settings is one thing. It needs to be managed. It's a concern, obviously, for communities and people living in that area, and that's what we are addressing right now. But again, like I said yesterday, 8 cases in the geography of Southwest and Central who don't really have any links to exposures also needs active follow-up. So it's not just the total numbers. It's also, what do we know about transmission? And all of that doesn't necessarily impact the RT. So RT is just one thing we look at. We also look at transmission settings. And my final comment would be that on the one hand, we've been reassured that as we have reopened, our overall transmission hasn't gone up, but we have seen 3 cases now linked to restaurants, and that doesn't necessarily mean that we should not go to a restaurant or a bar. All it means is that we should do our own risk assessment. We should make sure that we follow the guidelines and practice that physical distancing. But occasionally we will see transmission now that we are out and about more than we were 3 months ago. But certainly we need to watch the trends and track not just the RT, but the settings in which transmission is happening.
Do you have a follow-up, Alex?
Yeah, so we've seen recent outbreaks in Hutterite colonies in the province, and I'm wondering, have you locked them down as you did with the North and the Far North when there were outbreaks there, or is that being considered, or can people in the communities basically move in and out freely?
So in the Northwest, the context was there were several communities of a total population of more than 10,000, and communities ranging in size from very small to as high as 2,500 for Laloche. And those communities had interdependencies for grocery shopping, for medical care. So there was a need to have some way of managing transmission among those communities. And so there were some restrictions that the communities themselves actually wanted to be put in place in terms of who's coming into the community. Like only initially residents were able to come in, and then there was some control over movements to slow down transmission, especially in terms of young people traveling from one community to another. So there is a specific context where a specific provisions are put in place on the advice and recommendation of local medical health officers and local community leaders. And that really assisted along with everything you need to do locally, staying home if you're sick, testing, contact tracing, minimizing interaction between households. Right now in the Southwest, we have a very different situation. We have communal living settings, which may be only 100 people, so it's very small. And we need to, again, be very careful about not stigmatizing or identifying small communal living settings. But again, the context there is that, it's a very small unit. It's like an extended household in terms of common eating areas. And obviously, those communities are working with public health to control transmission. Obviously, if individuals need to seek health care, they can and should. You should only go shopping if you're asymptomatic. Same principles that would apply to a household. But otherwise, it's a very different environment. But if there was a larger community with the transmission that was high, then obviously the interventions would have to be relevant for that context. And again, I've said in the past that if you were to see an increase in transmission anywhere in Saskatchewan, a larger community, then some specific provisions around not closing down or going to lockdown, but maybe more emphasis on mask use. That was done in the Northwest actually quite diligently. I think many communities in the Northwest, everyone was wearing a mask when they were going to a grocery store, for example, or going. So I think some of those specific interventions may be helpful, as well as some cautions if you see an increase in having any kind of large or small gathering till the case numbers come down. So I think we just need to be ready in the future to just be able to adapt some of our, especially social behaviors when we see an increase in transmission, especially small or large gatherings that we may have planned. We should be ready to reschedule those if you see increase in local transmission.
We'll take our next question on the phone line.
We have Carrie Tate with Globe and Mail.
Hi, thanks for taking my question. I'm wondering if you can describe how you've been working with Alberta Health as you trace the cases in southwest Saskatchewan, particularly tied to the Hutterite communities, and if they're perhaps at all tied to the funeral recently in Alberta.
Yeah. So I'll maybe answer that in at two levels. One is that, and I'll start with some broad statements. One is that, I've always said that, if you plan to spend your summer, stay close to home. But at the same time, 2 months ago, interprovincial travel was not recommended unless essential. Now, interprovincial travel is permitted. And we continue to see, cases from interprovincial travel, whether for work or, visiting friends and family or just for, social reasons. And so this is just a reminder for all of us that it's not really where you're going within Saskatchewan or to other provinces. It's why you're going and what you're doing. So if you're going to be attending a gathering that's allowed in another province that may be large, you just need to self-monitor yourself and be aware that your risk of testing positive may be higher, and seek testing at the first sign of symptoms. So those are general principles that apply to all of us. But in this specific situation, obviously, there's relationships across the border between Saskatchewan and Alberta. So local public health, medical health officers have been working closely across the border, and we are in contact with our counterparts in the chief medical health officers in the Ministry of Health in Alberta. And that is just standard. It doesn't matter if it's an outbreak linked to specific communities in this case, or whether it's related to outbreaks related to a work site. The principles are the same, and we work collaboratively in Canada, especially with our neighbors, but with any other province or territory, to address issues as they arise.
Follow up, Carrie?
Yeah, can you clarify whether that the outbreaks in Saskatchewan at some of the Hutterite colonies are linked to the funeral in Alberta?
So, there's been mention of a large funeral. At this point, we have not found any clear linkages to that event. And in any case, as time goes on, what I've said is, we keep moving on in 2-week intervals. And what we have to understand is that chains of transmission sometimes can be undetected because in 30% of cases, individuals may be asymptomatic or may have been so mild in terms of symptoms that they may not have sought testing. So I think it's less useful to think of events that happened 4-6 weeks ago, and more useful to think of, okay, what were your immediate contacts 2 weeks ago? How can we notify immediate contacts? And settings in communal living arrangements, most of the contacts are actually within that setting. So it's not really that difficult to trace contacts. And then all that needs to be done is, isolation if you're unwell, and testing if you're unwell, and isolation if you're close contact for 2 weeks. And that's how you get over that outbreak. But again, I think the caution for all of us is that, if you are, have, if you are in a setting where there's an outbreak, then it's not really advisable to attend a funeral or have a large gathering like a wedding, or attend a wedding in another location until things have settled down. And it has been hard for all of us. I mean, all of us can count instances where we did not go to a funeral because we thought we want to keep numbers low, even though we could have gone and expressed our condolences in other ways. And similarly, many families have, rescheduled weddings or other important milestones. And I think that's what we will continue to have to do.
We will take our last question on the phone line.
We have Lisa Schick with CJME.
Hi there. My question is just kind of on the Hutterite communities in the southwest there. In the release that was put out from the SHA in June on those first outbreaks, it says, I have it right in front of me here. That there have been some challenges getting some Hutterite communities to implement adequate COVID-19 protocols and to abide by the public health orders. Is that still a challenge in the Hutterite communities in the southwest and in some of the new communities that are also dealing with cases right now?
So maybe I'll make some comments and maybe ask Scott if he wants to add something. But I think we have to understand that if you have a communal living setting, there are challenges because, the way of life is that you eat together, you pray together, and it takes some organization to sort that out. And again, I think if you are identified as a specific community, there's always some concern, some about people will point fingers, and you have to have that confidence between public health and health staff, and that there should be no stigma in coming forward for testing, and there's also some fear and uncertainty. And I think it's also fair to say that people who were traveling internationally in March expected that they may develop symptoms and seek testing, but certainly if you're more rural, there may have been a sense that maybe you're insulated from COVID, but obviously that's not the case for anyone in Saskatchewan or Canada. There's no place that's safe, and exposure can happen due to no one's fault. And when it happens, it just has to be dealt with in a systematic way, and that's what's happening. So I think there's been great progress that has been made in working with all communities to enable that. And I'll just see if Scott has any further comments.
And I would agree with what Dr. Shahab has said, and I would again say that through the work of public health folks on the ground in the Southwest, together with the Hutterite Safety Council, which represents the colonies and was created tri-provincially to support those communities being aware of public health guidelines and safety measures to avoid COVID, that we're not experiencing any difficulties at this time. And I would say, in fact, through the leadership, the joint statements of the local public health with the Hutterite Safety Council and the leadership of the Hutterite Safety Council and leaders in local colonies, we've been invited on to those communities. And that's why you're seeing the case numbers come up, because we're actually going in there and doing active case finding and talking to folks about what we need to do to keep them safe. And we're seeing great cooperation.
Follow up, Lisa?
Yes. I was just wondering, I guess, is there a possibility, what would have to happen, maybe it's a jump in case numbers or something else, what would have to happen for restrictions to be put in the Southwest like there were in the North when there were those outbreaks, things like travel restrictions, providing places to isolate, that kind of thing?
I think, like I said, you have to look at the context. Right now, we are talking about individual cases. In 10 cases, we've had great compliance in Saskatchewan with people voluntarily, choosing to isolate as directed as a case or a contact, and where people have had unstable housing, the SHA has stepped forward to support along with communities and social services to provide alternate housing, which is not the case right now in the Southwest. There were some challenges in the Northwest, but the Saskatchewan Health Authority and other government agencies stepped forward to support isolation where that is not possible in the household due to crowded situations. So that's not the case right now. And similarly, I think the communal living arrangements right now, the communities are so small, that's a very different context than a large community with interdependencies where, some where the local leadership actually wanted some control over in the Northwest, unnecessary travel between communities. I think right now the expectation is, and which is, as far as I know, is being met, is that, if you are in a community where you have been identified as a case or a contact, you will isolate for 14 days, and public health regularly confirms compliance with that.
And that concludes our time today. Thanks for joining us.